Are you out
Not
somewhere?
again.
Where are you, Isaac?
Barely awake, huh?
Need some sleep? Oh, you can't. You've got a test coming. What kind of test? What kind of test?
Pre-calc.
Oh, that doesn't even sound good.
Obsessive-compulsive disorder has become an increasingly visible affliction. Howie Mandel, the host of TV's Take It All, has OCD and has been recently making the talk show rounds, discussing how this disorder has affected his life. Mandel says, "I have an overwhelming fear of germs." This is one of the manifestations of OCD, and there are many others. According to The Hidden Epidemic of OCD, before the late 20th century, people were not diagnosed with OCD, but were considered to be problem people. The daily life of a person with OCD can be quite difficult. They may be so focused on their obsession or compulsion that it causes them to miss out on other activities. According to the June 6, 2005 issue of the Archives of General Psychiatry, approximately 2.2 million American adults are diagnosed with OCD each year. Let's look at what OCD is, survey some of the behaviors that are associated with it, and then examine the forms of treatment that are currently available for OCD sufferers. Obsessive-compulsive disorder can be defined as a disorder in which unreasonable thoughts and fears lead people to repetitive behaviors. Their obsessions are not always rational, especially when anxiety comes into play. This is because anxiety triggers ruminating thought patterns, causing people to repeat behaviors over and over, sometimes without their realizing it. OCD can be caused by a number of things: chemical imbalances, brain dysfunction, genetics, infection, or even depression. There are several types of OCD behaviors, most in which involve repetition. First, there are the checkers. As defined by the medical website AllPsych Journal, a checker is one who checks constantly to prevent something bad from happening. They live with the constant fear that harm will come to them or others if they do not check and recheck certain things. Did I shut off the oven? Did I lock the front door? Did I feed the cat? While these are all things we experience these questions from time to time, most of us usually check something once and be satisfied that all is well. But a person with OCD is compelled to check the same thing many times, always convinced that they may have missed something. Another group is known as the washers and cleaners. They have an exaggerated fear of contamination. Washers and cleaners feel that diseases will be spread if there are germs, bacteria, viruses, dirt, or other foreign substances present. Again, while most of us are content with the occasional squirt of hand sanitizer, a compulsive washer may clean their hands so often that their skin becomes highly irritated. This also gets in the way of work or leisure time, for when something triggers their compulsion, their life comes to a complete halt until they are satisfied that the contamination has been eliminated. Orderers present another kind of OCD behavior. They are constantly focusing on making sure objects are in the right order or exactly right place. Everything must be perfectly aligned before they can move ahead with the rest of their day. An orderer can experience great distress or anxiety if an object is even a fraction of an inch out of place. Next, we have obsessive behaviors. This occurs when a person experiences unwanted, intrusive, or horrific thoughts or images of harm being caused to themselves or others. Examples include continuous praying, counting, or repetition of certain words. These behaviors may appear to be extreme to an outsider, but to a person with OCD, they feel comforting. Unfortunately, this imagined comfort comes from a great cost in wasted time and mental energy. Our final example is the hoarder. A hoarder is someone who has difficulty throwing away things that most people would consider completely without value. Their homes and garages are often crammed with items that they will never use. Or more dangerously, rotting food that they cannot bring themselves to dispose of. There is even a TV show dealing with this phenomenon called Help, I'm a Hoarder. Hoarders often risk having their children removed from their custody or their homes condemned. While all these behaviors have debilitating effects on people's lives, there are many treatments available in which can help stop or at least decrease the disruption of OCD behaviors. One is the use of selective serotonin reuptake inhibitors. These medications include paroxetine and sertraline. They work by preventing serotonin from being pumped back into the original neuron that released it. The use of these medications are often coupled with psychotherapy. As related in the book Cognitive Behavioral Therapy by Tao Lin, cognitive behavioral therapy is a psychotherapeutic approach that aims to solve problems concerning dysfunctional emotions and behaviors through goal-oriented systematic procedures. This has been shown to be the most efficient way for treating OCD. Other treatment options include psychiatric hospitalization and electroconvulsive therapy, in which seizures are electrically induced to patients, bringing about a therapeutic effect. Deep brain stimulation, which works by implanting a medical device called a brain pacemaker that sends electrical impulses to a specific part of the brain in which helps control certain behaviors. While obsessive-compulsive disorder can be disruptive to people that struggle to live normal lives, modern techniques for treating this disorder can free its sufferers from the grip of repetitive behaviors and ruminating thought patterns. We've defined OCD, looked at the most common behaviors associated with it, and examined the treatment options that are most successful in controlling these behaviors. Thanks to the advances in diagnosis and treatment, you may not even be aware that someone you know is living with OCD.